I'm gonna go ahead and start recording. Everybody who's here, thank you for joining us. We know it's hot in Indiana. This is an important topic that we want to cover. So first things first, Dr. Kowalczyk, what is your name and title, and can you spell it for us, please?
Yes. So I am Kara Kowalczyk. I'm a pediatric emergency medicine physician at Riley Hospital for Children. And my name is spelled K-A-R-A, last name Kowalczyk.
Thank you. So since we're focusing on kids today, what are some signs of dehydration in a child?
Yeah, so this time of year, we really worry about kids getting dehydrated. So some signs that parents can look out for: if you notice that your child is becoming very, very thirsty, if they have decreased urine output, if when they cry, they're not making tears, those can all be signs of dehydration.
What are the proper fluids for rehydrating a child? Is water the best, or should parents consider like a sports drink?
Yeah, so I think it depends. Typically day to day, water is going to be the best thing because you don't want to sugar overload your child, because many sports drinks are really full of sugar. But I think when they're playing outside on a really hot day, or like with athletes, it is okay to get some electrolyte containing solution, so something like a sports drink, but I would recommend picking the sugar-free varieties. But you want to stay away from trying to rehydrate them with things like juice or soda, because that stuff's just really full of sugar.
What's the difference between heat stroke and heat exhaustion?
Yeah, so there's some overlap in these diagnoses, and they both can be really serious. So two things that tell them apart. So heat exhaustion is heat elevation less than 104 degrees Fahrenheit, whereas heat stroke is greater than 104 degrees Fahrenheit. But heat stroke, you typically will also have neurologic changes. So patients with heat stroke will have altered mental status. They might go unconscious, pass out, have seizures. You can see some mild neurologic changes with heat exhaustion, but as physicians, anytime we see any of these neurologic changes, we're going to consider heat stroke.
What should a parent or guardian do if they suspect either heat stroke or heat exhaustion?
Yeah, so when your child's getting overheated, the most important thing is to first get them to a cooler area. So if you can, get them in air conditioning, but if that's not readily available, move them to shade, get them something to drink if they're alert and able to drink. If you're worried about heat stroke, so if they're altered and not acting normal, you should call 911. If they're just feeling a little bit hot and dizzy, get them to that cool place, get them something to drink. But if the symptoms are not improving rapidly, then you do want to seek medical attention.
What are the dangers of leaving a child in a hot car, or a car on a day like today, or any day the rest of this week and summer?
Yeah. So as a pediatric ER doctor, this topic just like really terrifies me because it is so dangerous. There really is no temperature that it's safe to keep a child in the car without the air conditioning on and another adult in there. And so we really need to encourage parents to, not leave their kids in the car. It's not okay to run inside and run a quick errand, even if it's just for a few minutes. And also make sure you're remembering that your kid's in the car. This sounds kind of silly, but we've all been there where we're tired, busy, exhausted, and forget something, and you don't want to leave your child in the car.
What are some things parents could do to remind themselves that their child is in the back seat?
Yeah, I love this question. So one tip that we have is to put something that you're going to need to take with you in the back seat. So whether that's like your wallet, your purse, your cell phone. If you have a key fob, like an automatic start, you can leave your key in the back since a lot of cars won't let you lock it that way. Other tips, you can put like your child's diaper bag in the front seat to try to remind you that they're in there. Some parents like to use a trick where they put a stuffed animal in the car seat, and then when they put their child back there, they put the stuffed animal in the front seat as kind of a reminder that the child's back there. or you can set an alarm on your phone.
As it warms up, a lot of parents will be seeking places to cool off. So we think of like splash pads or pools and things like that. And we also think of activities for our kids like playgrounds. How dangerous is it for like the plastic getting hot or like the ground at the splash pad? What kind of warnings do you have about that?
Yeah, so I mean, as a pediatrician, I love to see kids out playing, and I think we just need to take some precautions. So it is possible to get burned from really hot playground equipment or really hot pavement. And so, make sure that you touch the things before you send your kids out to play barefoot. So put your hand down, see if it's too hot to keep your hand down. If it is, it's going to be too hot for them to play. So what I recommend is really targeting these areas earlier in the morning or later in the evening when it's not quite as hot out.
I have a couple of questions from a reporter related to kids and sports. One is, how often in a 1 hour practice or game should kids be taking drink breaks in a heat like what is expected?
I don't know if there's an exact number answer, but I think at least every hour children should be given time to take a break, to stop practice, to drink water. But when our temperatures get as hot as they are this week, I would really recommend maybe even twice an hour. But also, I know some sports can be pretty intense. We like to kind of push kids to their limits. But this time of year, it's really important to let kids feel like they can speak up. And if they're feeling thirsty, that it's okay to get a drink. That's what I would encourage coaches to promote.
Should coaches adjust practices for sports like football during this heat?
So football is going to be the sport that we do see the most heat exhaustion and heat stroke injuries with. Historically, they occur in August because that's usually the hottest month, and that's when a lot of football practices are. I think coaches just need to be cognizant of these risks of practicing in the heat. I can't speak whether or not they should change their practice time, but I think the risk of the heat exhaustion or heat stroke is going to be lower earlier in the morning or later in the evening. So that would be the safer time to have practices.
Wonderful. Thank you, Dr. Kowalczyk. I'm going to open it up to the people who have joined us today. Vincent, I saw your hand was raised. What is your question, dear?
Perfect. Hi, Dr. Kowalczyk. My name
Hi.
is Vincent Martirano. I'm with Win 15. I have a couple quick ones for you. But you being a physician working a lot with children, how often in the summertime do you see children coming in with medical conditions due to the heat?
Yeah, so it's pretty common, I'd say, on really hot days. We might see several patients in a shift with heat-related injuries. I remember a really hot day when I was working at a hospital near a water park. I saw several kids, and I know several adults also came in from just getting overheated or even passing out. And so it is going to be a couple patients a day in these hot conditions.
Yeah, and do you recommend people try and not leave their house or air-conditioned areas, or is there a set amount of time that you recommend they leave, or is it okay to just go ahead and do as they please as long as they're taking safety precautions? Do you recommend a certain amount of time or not at all to be outside?
Yeah, so I think it's really person dependent. And so, people who have certain medical conditions that make them more susceptible to heat exhaustion should definitely take more precautions, and potentially I would recommend them to stay in the air conditioning. But I think if people are taking precautions, keeping themselves hydrated, you don't have to absolutely limit yourself to the air conditioning, but as soon as you feel hot, tired, to really take a break.
Yeah, and last one for you. We talked about different medical conditions that come from the heat, like dehydration and heat stroke and heat exhaustion. Are there other kinds of conditions that can form, or children specifically can get from the heat?
I'd say that you cover the major ones, but sunburns would also be a problem that we see a lot this time of year. So people who are just out in the sun too long. So certain kids with things like diabetes, ADHD, seizures, other chronic medical problems, they are going to be a little bit more susceptible to the effects of overheating.
Awesome. Well, those are all the questions I have for you. Thank you very much.
You're welcome.
Is there anybody else that would like to ask a question? If not, Dr. Kowalczyk, I wanted to clarify, I know several had asked about adults. Could you say the signs of heat exhaustion and heat stroke would be similar in adults for kids, or what some of the bigger differences between adults and kids?
Yeah, so the diagnoses are generally the same for heat exhaustion and heat stroke. The difference with kids is they can't always communicate how they're feeling. They can't always say that they're too hot or ask for a drink. Kids don't sweat as much as adults, and so they're going to unfortunately suffer heat exhaustion faster than adults, and they also acclimate less quickly than adults.
Is there anything else you'd like to add on heat safety before we move on to our bonus topic?
No, I think that's all.
Perfect. Well, for those of you, if you didn't see my email, I know some have severe storm warnings, some are under a slight risk, and others are under enhanced. And Dr. Kowalczyk is part of a team that is shedding information or shedding light to information for families to prepare kids for disasters. And it's good to talk about disasters at any time. So I was going to ask a couple of questions of her, and it's just a bonus. So Dr. Kowalczyk, how should families with children prepare for a disaster?
Yeah, so we never know when disaster is going to strike. And I think this time of year, when we're seeing all these severe storm warnings, is a good time to think about it. So I recommend that everyone, whether you have kids or not, has a disaster preparedness kit in your home. So this should include 3 days worth of non-perishable food items, water, a flashlight, things that you might need in case you don't have access to your usual day-to-day supplies. For kids, also include some sort of distraction item that's important. And then if anyone in your home is on any medications, I recommend keeping either backup medicines if you have the ability to do that, or at minimum, keep a list of all the medicines that you're on. I think it can be important to keep all of your medications organized in one area. So in the case of any sort of disaster, you can kind of grab and go your meds or any other medical supplies that you may need.
Perfect. How about families who have children with special needs? How
Yeah,
should they prepare?
Yeah, absolutely. Really families of children with special needs, or really any, person who has any dependence on technology, needs to think even more ahead of time about a disaster. So with these storm warnings, we might see power outages. So think ahead of time what you're going to do if you were to suffer a power outage. Things that I recommend, you can look into obtaining a backup generator, but obviously that's important, or that's expensive. Sometimes insurance companies may cover this depending on what equipment is used in your household. You can let the local fire departments know that you have someone in your home that is technology dependent, and they may be able to help you a little bit faster. You can let the power companies know, and they may be able to restore your power a little bit sooner. But also have a really deep list of contacts. So families, friends, neighbors, people who could help you if their power is not out.
Great. How can people obtain critical medical supplies like medications, formulas, or nutritional supplementation if something like a large tornado were to happen? For example, like we've seen in Kokomo a few years back.
Yeah. So again, preparedness is kind of key here. So really stocking up, and every 6 months, really going through that disaster supply kit. So having formula in there, having extra medicines in there, and constantly updating that. But obviously that's not perfect. Resources like the Red Cross and different shelters in times of need may be able to help with those resources. But again, I just really encourage preparing ahead of time because it can be hard to find those resources.
Is there anything else you want people to know about disaster preparedness for families?
I think that really covers the majority of it. Our big takeaway is really just think about it ahead of time, because it's a lot harder to kind of recover after something has happened. But you'll be so thankful if you really create that disaster kit and that list of contact resources when something happens.
Awesome. Does anybody have any other questions for Dr. Kowalczyk before I let you all go? No? All right, Dr. Kowalczyk, thank you so much for your time.
Thank
Thank
you.
you, everyone, for joining us.
Yeah.
I'll get this uploaded and we'll see you all later.
All right, stay safe and cool.
Thanks all.
Bye.